learn to tie knots and suture. That takes a little bit of time, and it's rather cumbersome, especially in the field. So these things are great.
Yeah, I'm not a vet like Randy, but I do a lot of running with my dog on the trails all around Sun Valley in the area. And when it gets hot, you have to make sure there's a river or a lake or some water source around. Even just bringing a water bottle, you probably won't drink most of it, your dog will. Make sure you can squirt it in their mouth or take a Camelback and squirt the hose, because dogs need a lot more water than we do, and that's something that people overlook, and you can get in real trouble if your dog gets dehydrated.
Prevention is probably the most important of all things for dog injuries. Almost all the injuries can be avoided with proper planning and good judgment. Before you go, make sure your dog's in shape for the kind of exercise you're going to do. Your dog ages 10 years for every year you age. Trimming the nails will help prevent broken nails. In the wintertime, the nails get long. If they step on a rock or an object, they'll split the nail. So keep your dog's nails trimmed. Along with that, if you have a long-haired dog and it's the summertime, the cheatgrass is out, make sure you get a field cut to prevent the burrs from getting accumulated in your dog. Consider the dangers you might have at your destination. Is the area full of snakes? Make sure about diseases, Lyme's disease, heartworm disease, parvovirus. Make sure your dog's current on its vaccinations and worming. Consider the weather. If it's extremely hot, make sure you have adequate water. If there's going to be thin ice on a river, keep in mind that your dog doesn't have any clue. He'll chase that tennis ball right out in the middle of the river and he'll fall right through. Safe transportation is important. Broken femurs occur commonly falling out of the back of the truck. Dogs should not ride in the back of the truck unrestrained. You need to use a very kennel. You can cross tie your dog to the front of the truck. If you have a camper, that works great, as long as it's well ventilated and won't accumulate carbon monoxide. If it's extremely hot, make sure that the dogs are getting aired occasionally. Make sure they have water. Make sure you transport your dog safely.
Okay.
Yeah. Should your dog break a leg, hopefully that won't happen, not too common, but there is a bandage you should learn to apply if they do break a leg. The bones you're going to splint are the radius ulna, the carpal bones, the tibia, and the metatarsal bones. You don't need to splint a femur, you don't splint a humerus, so the only bones you're going to splint are from down here and down here. What we're trying to do with the Robert Jones bandage is we're trying to prevent the swinging of the cut bone end from lacerating nerves, from cutting arteries. The pressure also decreases the swelling in the wound and helps prevent bleeding. So we'll go ahead and apply one to Tate here. In this instance, we'll pretend that he's broken his radius ulna. This would be flopping back and forth, and you're trying to stabilize it temporarily while you get to some professional help. There's a variety of things that you could use to apply the padding. You would want to try to poke the bone inside the skin if possible, if the bone's extending out. If there's any bone left on the road or on the trail, you would want to put that in a moist cotton and save it. As an orthopedic surgeon, I love to have all the bones when I put fractures back together. We could, if we had to, use a t-shirt, for instance, to apply some padding around the leg. A couple of t-shirts, some cloth, something like that. You try to go to the joint above, just slightly above the joint above the break, and the joint below the break. So you'd apply some padding, then you'd apply some stretchy tape. This would get a little tighter as the layers went on. You want a lot of padding in there and just good even pressure all up and down the leg. To prevent the swinging motion, you can use whatever's handy. Perhaps there'll be a stick there.
Okay.
This stick would work just fine to prevent this leg from swinging back and forth. You might want to use one or two depending on how it looks. But anyway, basically you can find something wherever you are to prevent this from swinging back and forth. This is called a Robert Jones bandage. Basically, it applies smooth, even pressure up and down the leg. It prevents the bone ends from lacerating nerves and arteries. It prevents swelling, and it'll keep your dog's leg in better shape while you get to professional help. Let's see how that works for you, Tate. Come on. Possibly they'd be able to walk out on it.
Boy.
A common bandage you'll need to learn to put on is a foot bandage. This bandage is useful for a lacerated pad. It's 7 o'clock at night, you're at Faraway Lake, your dog comes into camp, he's bleeding profusely from the bottom of his pad. What are you going to do? Perhaps if he has a broken toe, you would feel the broken toe, it would be clicking here. Perhaps if he's torn a nail. Dog boots are okay, but they really don't put enough pressure on to control bleeding. These foot bandages are fun to practice at home. You should learn to master this bandage. You start with cleaning your wound and preparing your wound, and then this gauze padding conforms to the leg real nicely. Now, if this dog had a real severe bleeding foot pad, you would probably apply this bandage pretty tight for the first 2 hours. Then you might take it off and apply it looser. I'm just doing a figure of 8 type motion around his foot. All I'm doing is trying to cover the foot. The only thing that's going to hold your bandage on is this right here. So we want to have a tight wrap of tape right here. You do have to bandage the whole foot. They don't wear a Band-Aid like we do. You'll have to bandage the whole foot, even if they have just a cut here or a cut down here. So we use the cast padding first. Then we'll go with the elasticon. This is stretchy tape. It conforms to his foot. It's not going to be too tight in one spot or too loose in one spot. So we again kind of take this motion and we cover the whole foot with this. When a dog steps down, their foot expands, just like you when you step in some new shoes. So if you want to make this bandage more comfortable for your dog, you'll put a little pressure on it as you're applying this. That's kind of a looser bandage. That would be the bandage you put on after the bleeding is stopped. And then to finish up, you can use a little bit of waterproof tape, a little wrap around here, a little situation like this. This would definitely get you through that two-day backpacking trip. He can walk down the trail on this. He won't get dirt in his wound. He'll feel comfortable on it. He'll walk on it just fine. If you want, and you have a dog boot that you could put over the top of this, but the dog boot typically is going to get full of dirt. It's not going to put the proper pressure on there, and the foot bandage is a simple way to deal with a common injury. Let's see how you like that, Tate. Takes them a while to get used to it. Doesn't it? Yeah. Another common injury going through fences is, or perhaps wagging in the kennel, is a laceration to the tip of the tail. This centrifugal force, when they wag, slings blood everywhere. And these will go on for days and days and days bleeding. A tail bandage is essential to get this bleeding stopped. What we'll do is we'll slide this over the tip of the tail.
Okay.
We'll split our elasticon tape down the middle. This tape's real sticky. It adheres to the skin or the hair real well. We'll put a tube, we'll put a stripe of it up either side. The essential part of this bandage is to tape to the hair. You don't want to put a constrictive band around the tail itself. This bandage is going to be held on by the hair. We'll go back to our sticky tape. We'll take some hair and we'll tuft it out around the tail. We're taking hair to plastic here. And as we work up the tail, we're not squeezing the tail down very tight, but we're incorporating hair in our bandage. These bandages are hard to keep on unless you incorporate the hair in this fashion, and you certainly don't want to apply a tourniquet to your dog's tail. But now this bandage will stay on. When the dog swings his tail, whacks into the brush, whacks into you, hits the car door, this bandage will stay on, and this prevents that wound from bleeding all over. So that's a tail bandage. Doesn't look real pretty, but it does prevent blood from flying all over for the next week or so while that wound heals up. It's also used for dogs that have been in a kennel and whacked the kennel too many times. Again, it'll look like a chainsaw massacre unless you apply this thing. Gastric dilatation and torsion, or torsion as we call it, is a true emergency. I hope you never see these symptoms, but I hope you can recognize them if you do. This dog is extremely painful. It is starting to bloat, usually at the left side of the abdomen. If you hit it, it sounds drum-like or gas-like. What's happening is the stomach has actually twisted. The esophagus is twisted shut and the duodenum is twisted shut. So you have a barrel inside there with food in it, and it's starting to ferment. The dog cannot belch and it can't pass gas, so this distension in the abdomen is extremely painful. The dog may attempt to vomit. There may be some clear foam coming out of it. If you see these symptoms, this is definitely emergency, and you should proceed as possible to your veterinarian. If we get these dogs and correct them surgically within the first 2 to 4 hours, they're usually going to live. If they go 8 to 12 hours, often when we get in there surgically, the stomach is black, it's necrotic, we get ventricular premature contractions, we have dead stomach, and this patient's usually going to die. So hopefully you won't see signs of a torsion, but if you do, this is an emergency, it does stop your trip, and you need to get to the veterinarian. The best treatment for snakebite is probably avoidance. They do hold avoidance training classes. They'll have a defanged rattler, they'll have a shock collar on your dog, and they try to teach the dog to avoid the snake by smell, by sight, and by sound. So the best thing to do for snakebite is to train your dog not to get bitten. In the event you haven't done that and your dog does get bitten, the usual scenario is they're hiking, they go into a bush, they're sniffing around, the rattler rattles, they stick their face down there and pop, they get it right in the face. There's a yike, they come running out of the bush, There's two distinct fang marks. They're starting to bleed a little bit. Couple little lines of blood coming down out of those snake bite marks. Again, 80% of them are going to be on the face. It'll start to swell immediately. Your dog may stagger, may get a little shocky, may go down. At this point, you can pretty well assume that was a snake bite. So what do? Do you run to the car? Do you run to the vet? Do you put on electrical stimulation? Do you put on an extraction device? Do you ice it? Do you tourniquet it? Controversy seems to surround what we do with snake bite. Basically, the Western Diamondback Rattler, most bites are not fatal. Some snakes envenomate more or inject more venom than others. Out of 6 we've had this summer, 1 died. But most of them do not die. The field treatment would be to calm your dog. If you start running, if you get real excited, you're going to increase the speed of the venom absorption, which may cause the heart to stop. So you calm your dog, you walk slowly back to your vehicle. I actually would passively ice. My theory is that if you use a little bit of ice, you cause vasoconstriction, which delays the absorption of the venom. I don't want you to freeze the wound to make the tissues die, but you could passively ice the wound.